So mental illness and metabolic conditions. In the general population, metabolic syndrome is about 20-25%, where a person has at least 3 of those. Severely mentally ill population is even higher, all right? So the population that we work with that see us are more likely to be ill, to be metabolic illness than the general population, which is also high. Bipolar disorder, on average, takes about 11 to 20 years off your life, all right? Depression is about 5 to 10, bipolar 11 to 20, schizophrenia about 20 to 25 or even more. So when you see your schizophrenic population, when they hit about 30, they're about middle-aged at 30, all right? Now, I've never seen somebody so depressed that they cried and rolled up into a big old ball and died, all right? Never seen that happen. I've never seen somebody who is manic, who didn't get enough sleep, who fell over dead because they didn't get enough sleep, or a schizophrenic who was so psychotic that their head exploded. Understanding what kills our patients, all right, is metabolic issues that go along with mental health. So too often we're focused on treating the depression, we're focused on the bipolar, schizophrenia, ADHD, whatever mental health issue or condition it is, including anxiety, you're more likely to die if you're diagnosed than if you weren't diagnosed and don't have a problem. But we've got to focus on what is going to kill the patient, which is going to be heart disease. All right? All of these things lead to heart disease and stroke. So a meta-analysis of women, of both men and women, of obesity showed that 55% have an increased risk of developing depression, and depressed patients have a 58% increased risk of developing obesity. So the two illnesses go along with one another. Mental illness and obesity and overall metabolic issues go together.